here. So thanks everybody for taking some time out. Hope everybody had a wonderful weekend and had a good memorial holiday. Yeah, as like I said, as part of just a focus this month on some retirement related issues. Healthcare is obviously a big part of that, and this transition into Medicare is one that comes with a lot of questions and decisions and kind of this alphabet soup of A and B and D and different plan numbers to choose. Yeah, and then the Medigap policies and Medicare Advantage, and so just wanted to make this time available for a client and friend of mine I've known for a long time now, Fariba Zarieh, and she is one of the top people in San Diego and West Coast. I don't know the extent of what she would say, but I know that she's very in demand for a lot of speaking. She's been doing this for a long time. She's forgotten more about Medicare than I even know with stuff around, and so just very happy that she would take some time to make this available. She'll go through some presentation on Medicare and some of the topics, but then just especially to be available for any questions that you have regarding eligibility and enrollment, and while you're working, or things related to coverage, and but then also she can be available afterwards if you want to just spend a little bit more time with her of kind of nailing down decisions that you have to make, and around your situation and lifestyle and needs and those kinds of things, because it can be unique to different people and what they're used to and what their expectations are for healthcare needs in retirement. So before we get started, I just wanted to let you know, I'm going to put a few things up here, and so these are some things that we're not necessarily going to dive into now, but if you want me to send any of them, these are some flow charts that I have available to me. The first one here related to healthcare, changing as transition into retirement, and there's a number of different things just related to Medicare, but also earlier retirement and what health care decisions might need to be made for people of retiring prior to Medicare eligibility, and then some things around eligibility for Medicare Parts A and B. Again, just some of the nuts and bolts details. Will you be automatically enrolled in Medicare? Will you be able to avoid Medicare enrollment penalties? And then there's a thing for higher income individuals where there can be extra surcharges on some of the costs of Medicare that we can go through. If you have concerns about that, of what would need to be done to avoid any of those kinds of surcharges. So if we need to look back at any of those during the presentation, we can. But if any of you would just like for me to send those to you so that you have them handy, just go ahead and put that in the chat, and we can make sure to get those over to you. So with no further ado, Fariba, thank you for joining us. And
thank you for having me, Jeff.
Stop sharing now, and you can pull up anything that you have.
Okay. Thank you, Jeff, first of all, for being a friend and great financial advisor to me as well. Okay. And I appreciate you. Oh, I hope I'm not sharing. Okay. You see my screen? Okay. Again, thank you, Jeff, for having me. As Jeff says, I do Medicare presentation all over San Diego. I am specifically with United Healthcare, AARP United Healthcare. Been with them about 14 years. And I work with different medical groups throughout, and I'm licensed in 12 states in US. So I know a little bit about Medicare. If you have questions, I'm at your service. Today, we are going to cover a little bit basic Medicare, but I'm available for you. And I know I have a thick accent, so if you have a problem, let me know. I don't mind repeating myself. I'm Persian. I've been in this country most of my life. I couldn't lose my accent. It doesn't work when you come 17 years old, so it doesn't go away. So I'm going to go ahead and start the presentation, okay? These are Medicare guidelines. Under Medicare guidelines, every page of this one I'm covering is actually, approved by Medicare. So we are going to cover Medicare Advantage clarity, but I'm going to go on supplement and many more things, okay? So how Medicare works. If anybody has a Medicare or any of your family or friends or parents, they have it, Medicare has our flag color, red, white, blue color, and has a person's name on the top. And then they have a Part A and Part B and effective date on the plans. If you look at the Medicare card, it shows Part A, which is they call inpatient hospitalization. And Part B is anything outpatient. What falls under Part A is inpatient hospitalization, skilled nursing facility, blood transfusion as an inpatient, and hospice care. Part A, we don't pay premium. It doesn't mean it's free. Nothing in this world is free. Part of the taxes we paid, you have to pay 10 years or 40 quarters. We paid for our own benefit. But if you look at your paycheck, you're still withdrawing the benefit money from your from your check that we receive every month, because we are paying for generation in front of us. Government doesn't invest the money. The government takes the money from younger generation and distribute to the older generation. That's why it's a fear that Medicare has no more than 10 years money in it. So they have to reform Medicare. If they don't reform, I don't know what is going to happen. That's why they are raising the age and all those things, okay? So Medicare has to 2035, based on what they are telling us, has money in it. So baby boomer generation didn't have enough children. So the money is getting less and less to the pot, okay? Part A has no premium because we paid. It's an entitlement. We are not buying, we already paid for it. Part B is the one we purchased from Medicare, from Social Security. And what they do, Part B, what is under Part B? Part B covers anything outpatient, doctor visit, MRI, ambulance, anything falls under Part B. Average premium for 2024 is $174.70. As Jeff was saying, has a grid. Based on your income can go over $500 per month. And if you need it, Jeff has the grid, I have it, we can email it to you, okay? Let's assume you're paying $174, okay? And that covers all Part B, anything outpatient. But you don't see on your card has a Part D drug, right? Because Medicare does not cover prescription that we purchase from pharmacy. They cover prescription that administrated at the doctor's office, or like infusion, anything in the medical facility or doctor's office falls under Part B. Part A and B has a deductible, as a co-insurance under Part A per day after 60 days, then it goes up to, up to 150 days, Part A is inpatient, it covers no more than, and 60 days of that, 150 days is a reserve. If you use, let's say somebody, I had a client at a hospital during the COVID, he was in the hospital 4 months. If he had only original Medicare, not only had a deductible, he had a copay per day after 60 days, and it can go up to $800 copay per day, and 150 days is a maximum inpatient. So 60 days of it reserve. Next time he goes in a hospital, if he didn't have a secondary coverage or Medicare Advantage, he will have only 90 days inpatient. Okay, so think of Medicare like Swiss cheese. Swiss cheese has a holes all over, right? Has a gap in it. To fill that gap, you have two options. Under Part B, we have a deductible of $240. After that, Medicare only pays 80% of the bill. The other 20% will be your responsibility. So to cover that gap, you have two options. Option one, they call Medicare Supplement and Medigap policy. That's what Jeff was saying. Medigap policies fills the gap of Medicare for you. So Medicare is your primary if you go option one. Medigap fills the gap for you. So by going that, if you are turning 65, the best option for you will be Plan G, like George. Older people, like they had a Plan F. Have you heard somebody says, I have Plan F? Plan F has no copays whatsoever. You have to pay someplace in these plans. What Medi option one is, you never buy for copay. You buy based on your need and your use. Who will get usually, if somebody calls me, I had about a few months ago, I had a patient, a client, my new client that had a cancer in the brain. I hope she lasts a long time, but for her, the best option is option one, because it gives you a nationwide access to the doctors. A very sick person, in my idea, is Medigap is the best plan for them. Or if you say you are living and you have a home like a gentleman before, he's in Atlanta. Maybe his job is required 2 different residency, okay? For those people, Medicare Supplement will be a great option. If you go Medicare Supplement route, then you have Part D for prescription. Remember, option one follows original Medicare. If Medicare approves, supplement pays their share of 20% or whatever its copays are, deductible. And when you go, you see Part A and B has no drugs, so you need to buy separate part. They call Part D for prescription that you can buy from individual pharmacy. So if you go this option, you have premium for Medicare based on your income. Medicare Supplement, if you're turning 65 with United Healthcare AARP, that it is, if I'm that much sure of the supplement with AARP United Healthcare, because it's a group coverage. I'm telling you, if you want to check everything, you can go HiCap. HiCap is a nonprofit organization that they don't take sides. And if you ask them what kind of a supplement I should buy, they say anything community rating. What this word to you is, it means group coverage. For supplement purpose, AARP is the group coverage plan that has a contract with United Healthcare. So you have to be a member of AARP to get that. For being that way, you can have the premium increase is much lower and it stops in certain age. The other companies that they offer supplement, their premium keep going up and up to 90-something years old. So that's why highest enrollment on the Medicare supplement in United States is AARP United Healthcare. Okay. And me being with, because AARP, you have to be 50 years and above to get the membership. And we have a clients that is younger than, younger than 65 based on disability. So they have to be 50 and above to get the supplement from United Healthcare. If they're younger, United doesn't offer them plan. But I have a contract for that purpose. We have a contract, especially I do have more than United Healthcare contract. I can help you with that if you are younger than that, you are looking for supplement, okay? So if you have any questions here, if you want to ask me before I move to option
2. Since I'm still working
Uh.
and I'm 65, do I need to enroll in Medicare?
It depends. No, you don't need it if you have a creditable group coverage. which it means you have to have your job should have minimum no more than 20 employees. If it's
Okay.
less than 20, it's not creditable coverage. And I tell everybody, first, before you say on group, cover your group coverage with Medicare side. These days, we are seeing the group coverage is more expensive. Premium is higher because of since they call Obamacare or the new law that changed the premium, group coverage, the benefit they got lower, a premium is higher. Compare, you don't have to, will not be penalized. Let's say you are 67 years old and you want to get Part B, then you have to do a special Part B employment form and you will not be penalized for Part B as a boy or Part D as a drug. Part B premium, if you don't buy on time or if you have a group coverage less than 20 employees, then your penalty for Part B as a boy, it will be 10% per year for number of years you missed for rest of your life. And for Part D penalty is about 35 cents. National average cost of the prescription is 35 cents. So 35 cents, number of months you missed. But if you have a creditable coverage, don't worry. Okay?
All right.
Special forms you have to do, verbal attestation we do, and everything's taken care of. Okay?
So
All right.
Fariba, again, just to clarify that, for anybody who is not working or works for an employer that has less than 20 employees, then they would need to enroll for Medicare at 65, even if they are on a group plan with, with a company with 10 employees.
Okay.
Or some people, they say, I'm going Cobra. Cobra is not creditable coverage if you're 65 and above, okay? So remember, Cobra is not good either if you're 65 years old and above, okay?
All right.
Fariba, anything else on that enrollment or like eligibility topic in terms of, in that transition for, everybody who I had invited to this call is turning 65 either this year or next year. And so,
Okay. I'm gonna get there in a few minutes.
Perfect.
Okay, after this part, we go next slide, okay? Thank you. Thank you for asking. Option 2 is they call Medicare Advantage or Part C or HMO PPOs, falls under that. What is option 2 does? Combines A, hospitalization, plus B, medical, plus D, drugs, plus much more benefit. They call Medicare Advantage Part C, HMO PPO. If you go this route, this is most of people in USA is under option 2. Because the reason people, they don't know the doctors. Your primary is the one referring you. And all medical groups, they refer you in the HMO system. So they are going to send you, Sharp is going to send you to their own Sharp patient. Scripps is going to send you to the Scripps network. UCSC is going to do the same. So that's why most people, they go on that option, okay? Has more benefit. The premium on option 1, it can be from $0 up to $45 for PPO. But it covers more than option 1 premium on Medicare supplement with United Healthcare when you turn 65, about $130 a month. For you, it's more expensive option 1 than option 2. But in reality, Medicare pays on option 2 based on your health, based on everything from 1,000 to almost 1,900 a month to insurance company. It's a big difference in insurance company money that's receiving, but you are paying less in option 2. That's why insurance company offers more benefit in option 2 than option 1, because they receive much more money. Okay, so I just want to give you a heads up. When you're Medicare, you're going to get tons of calls they're not supposed to do before Medicare before we go through COVID, Medicare really was strict. Now they are going, lots of people are calling and switching the plans, okay? Make sure you know, because people are middle of treatment, they take them, they say, oh, your doctor is here, but they are not checking your doctors on the Medicare side of the plans. They are checking in all of their doctors, because some of them, they service the younger generation too, under age of 65. So please make sure, don't fall for those advertisings on TV, please. It's really horrible what we are seeing, okay? Be
All right.
careful, okay? Any questions?
No, I'm good.
Jeff, anything?
Oh, I know you get into a lot of other things, and if there's others afterwards, I have a list of things, so.
Okay. Medicare eligibility. This is the part I think, Jeff, correct me if you were asking about here. So to get the Medicare, you have to be US citizen or, or resident and live in the area at least 5 years, okay? And you can be 65 and older, they can get the Medicare, but we have a lot of younger generation, younger people. My youngest client is 22 years old now, because broke the neck while he was motorcycle, he's bedridden. So it doesn't matter the age if you're disabled, okay? Or you have a ALS or kidney failure. They can get any age, okay? When we enroll in Medicare, let's say we have people are aging in, we call, or they're gonna turn 65. You have initial enrollment period, 3 months before your birth month of your birth, and 3 months after your birth month, 7 months, you have initial enrollment period to enroll without penalties. So yeah, you can do anything in that period. When you enrolled, after that, we have an annual enrollment period. You see all the advertising on TV, October 15th till December 7th. We call annual enrollment period. You can make any changes. You can move from option 1 to option 2, from Medicare supplement to the Medicare Advantage plans, or vice versa, anything you can do, okay? After that, December 7th, the time closes. Then January 1st until March 31st, we have Medicare Advantage open enrollment, which that means we can make like-to-like plan changes, like from one Medicare Advantage to another Medicare Advantage, from one Part D to another Part D. It's limited, and you can change one time, all right? And sir, when you ask your question, obviously you're going to continue working after 65, and you're not going to get Medicare, okay? So you're going to fall in special enrollment period. You will have 63 days without penalty to apply for Medicare. And you need 2 forms, Part B employment form, another form that if you need it, I have the forms. I'm sure Jeff has the form. I have a special link, make your life easier. If you need my help, I'm a phone call away. Just
Okay.
a message. I promise I'll call you by the end of the day, okay?
All right.
So if you go the way I'm telling you, you will have your Medicare activated in 10 business days to 2 weeks. If you go Social Security office, oh my God, it's just, unless, by the way, if you are like me, you are naturalized citizen. For a person like me, they need our citizenship paperwork too, okay? So those people, they have to, you guys are not, but I'm just saying if anybody there that I don't see them, if they are naturalized like me, they need our citizenship number and all those goods, okay? Any questions? Okay, you don't only get a special enrollment there, okay? Also, like retiring, okay? Or if you move from San Diego to Atlanta, you get a special enrollment, 63 days, change of residency. But have you heard about Medi-Cal? Those are for low-income people. If you have Medi-Cal or low-income subsidy, then you can get another election. For the people with Medicare, every quarter they can make changes, only first quarter of the year. The fourth quarter doesn't work anymore, okay? So remember, those are a lot of different things. If you need it, just contact me, okay? Any questions? Jeff, did I cover what you were asking or not? Please ask me.
Yeah, so the difference between the October 15 to December 7 and what you can do, you can make any changes. Like you could go from a Medicare Advantage to a Medigap policy, or in that October 15 to December 7 range, but you could not make that change in the first quarter. In the first quarter, it's just kind of like
plan
changes. Yeah.
Exactly. That's what it is. Okay. So, but one more thing I need to tell you before we move from this page. Remember option one? Option one, you cannot change it anytime you want it. When you turn 65, you have 6 months to go the Medigap policy, no health question asked. After 6 months, if your health is not good, you're not qualified for that plan, unless you change your residency. If a person has Medi-Cal, they cannot get a Medicare supplement because they are low income to be qualified for that. They will not let you, okay? But United Healthcare, that's why AARP United Healthcare is the toughest sold. They give you a permission, without health question asked. Like if you go Medicare Advantage of United Healthcare, first 12 months. If you are not happy in this first 12 months, you can go to supplement, no health question asked. But you have to start their Medicare Advantage with United Healthcare, get that one to 12 months instead of 6 months. I have some people, they do that because they want to know if Medicare Advantage is going to work for them. All of a sudden they have a health problem, they call me, we change it. Okay, but 12 months, remember, that's the time period you can make a change.
So Medicare Advantage never has health.
No, they stopped it. They used to have about 7 years ago for kidney failure. Not anymore. Not anymore.
Okay. So the Medigap, the Medicare supplement plan is the only one that requires it if you're getting it outside of that initial 6-month window.
Correct.
Or you need that 12-month thing where you've started on Medicare Advantage, specifically with the United Health AARP.
12 months. Okay. And after that, only change of residency, and separate states, they have separate guidelines, because remember, anything, let me go back here, and anything with the like a part in it is a federal plan. Okay, they call Part C, Part D. Anything with plan, like Plan F, Plan G, Plan N, is a state plans. Remember, difference between part and plans. Does it make sense what I'm saying?
Does, yeah. I mean, might make a little bit more sense, I guess. When do you have something in there that shows kind of the different plans on the Medicare supplement?
I do have it. I can go with that. Let's finish a little bit more. If we have enough time, I'm sorry, I talk sometimes too much, but I guess I'm a woman after all, right? Just a joke. Okay. All right. 10 things you should know about Medicare. Okay. 1, you must continue to pay your Medicare Part B premium. If you don't pay your Part B premium, $174.70, you cannot have neither options. No option 1, no option 2. Only Part D you can buy. You can purchase Part D if you have a Part D if you have a Part A. If you only have a Part A, you're still eligible to buy Part D, but for other plans, you need to have an A and B. Does it make sense what I'm saying? I hope it does. Okay. You have to pay your premium. You don't pay, you don't get insurance. And believe it or not, it's really inexpensive for what you are getting outside in the market. Okay. Number 2, Medicare Advantage covers you all over the US and nationwide. Medicare supplement has, United Healthcare has only $50,000 coverage in world. But Medicare Advantage by United Healthcare has their worldwide coverage unlimited to emergency, okay? Number 3, joining a Medicare Advantage plan may affect your current coverage, sir. That's what you were talking about. I tell, review both sides, make the right decision based on what you see, okay? Number 4, it is best to use network provider. If you go option 2, if you're Sharp, use Sharp. If you're Scripps, use Scripps. We have PPO even goes nationwide now, but higher copays, okay? We never had a PPO in San Diego, but we had the supplement. Now we have supplement and we have PPO as well. Works the same format, but higher premium, lower copays, okay? Number 5, you may qualify for financial assistance. I tell everybody, if you have a low income subsidy, there has a chart for joint income is no more than 30,000. And if for individual income, about 17,000, close to $18,000 a year. If you are in that level, please apply for low income subsidy because it brings your prescription down to $0 or $1.55 or $4.60. It is like Ozempic is almost $800-900. That plan, if you're qualified for the low income subsidy, Ozempic becomes $4.60. Okay, everybody uses Ozempic now. They call rich people's medication. Okay, number 6, if you enroll in Part D late, you may have a penalty. Sir, when you said that you might delay, so when you retire, again, you have 63 days. When you fill up the form, you send it to Medicare, that prevents you from Part B penalty. But when you get the Part D from insurance company is gonna send you a letter for LEP, late enrollment penalty for Part D. They put LEP. Always pay attention to that. If you get that, if you don't respond, you will be penalized 35 cents per month for number of years you mess ongoing, okay? So on my purpose, what Jeff is showing, oh, I don't know. Something came on my screen. You don't see anything, just my screen, right?
Correct, yeah. I'm not sharing anything else. I just see your screen.
Okay, good. Okay. Oh, I'm sorry. Oh, it was a meets. I don't know what happened there. Okay.
But it looks like you stopped your share now.
I stopped the share. That's darn it. I knew something is happening. Okay. Sorry, my screen. Just bear with me again. Okay. Sorry.
No problem. While you're looking for that, so Mark said, so Mark's wife is turning 65 next year, and he's not going to be turning 65 for 8 years. She's currently on his insurance, and so just wanting to clarify about her needs. So spouse on current coverage, current work coverage. What does that spouse need to do at 65?
Okay. My experience, you are paying the highest to your spouse. Okay, your premium, majority of it's your spouse. So find out how much you're paying for her premium. Then look at we look at your income level, see how much is your joint, tax return, because they go 2 years back, right? This year, your income, when they are looking at your Part B premium, they are looking at 2022 tax return, 2 years back, and every year they go adjust it. So look at how much is your premium, look at your job's premium. Then look at the benefits from your job, get the benefit highlights, and we can do the benefit highlights for your plan or the medical group you belong side by side. see which one is more cost effective. Again, our experience that the spouse that's using the benefit usually much more expensive is their premium, because yours is your job is paying your premium. They are helping you, but they are not paying for your spouse.
And I've seen, I've seen definite variations on that. I saw one recently where I was amazed at how much the employer was paying for the spouse coverage. It was, it was very, very inexpensive, and the spouse or the employer was picking up more of the cost than what I see in a lot of other cases. So that, that part's going to vary employer by employer, but typically Fariba's right that in most cases most companies are going to pick up a much larger percentage of the premium for the employee and less or none of the costs for the spouse, and other dependents if they are younger people. I guess on that question though, is there any potential penalty for her if she turns 65 and she's on, again, that creditable coverage? It'd have to be creditable coverage with employer of 20 or more. But if they decide that that's a better cost benefit, to them, she can stay on as long as he is still on that work coverage.
Correct. Then she has to do Part B enrollment, like the other gentleman I was saying. You have to do the special employment Part B form. And in that form, they have, spouses, employer area. So they put, and they're going to put his information that he's the one is working, and Medicare accepts that. No penalty.
So she should still do that form at 65.
No, when he's retiring.
When he's retired.
When he's retiring. You
so even though at that point, then she would be close to, she would be 73 years old or so, just because of the age difference. She could go that long and stay on his work coverage if it continued to make sense for them.
Exactly. And no penalty. You have to do this special Part B employment form. Okay. And
all right.
Definitely no penalty. As of today, God knows what government is going to do next, but no, they cannot penalize you as long as it's a creditable coverage. That's the key, creditable coverage. Okay.
Fariba, so right now, it's showing a Cisco WebEx meeting.
I know I cannot, Jeff, stop that. When I'm force quitting and you don't see my screen, Jeff, can I send you this link and you can go next page, because
sure,
it's not, I'm doing resume, I'm force quitting, then it's take me out of that.
Okay.
Okay.
In the meantime, if anybody else has any other questions, you can certainly ask them or type them as well. But Fariba, can you talk just a little bit about provider networks? You kind of touched on that. Some.
Let me see, Jeff, is it going to work? Okay, just bear with me. Are you seeing that?
Oh, there we go.
I think I found it.
You got that happening.
I need to take a computer dummy 101 classes. I'm not the best.
No problem. You got a lot of people. You got a lot of people in that camp.
I'm the number one there. Okay. Any questions before we go number 7? Jeff, anything?
No, no. You can go ahead and finish that up, and then we can finalize with those.
Number 7, a Medicare supplement plan is not a Medicare Advantage plan. That's like option 1 is not option 2. Totally different thing, totally different guidelines, everything. So most people, I say, I have a supplement. If you are going Medicare Advantage route, don't say supplement, because it's really confusing to the doctors. We don't want to confuse them, okay? Because they are not good at insurance at all. Number 8, keep your member ID. If you go option 2, one ID you have has your name, doctor's information, Part D drug information on one card. You don't have to carry supplement. But if you go supplement, you have Medicare you have to carry. You have to carry Medicare supplement on Part D. You carry 3 cards, okay? Number 9, Medicare Advantage offers the same protection as original Medicare plus more, which I covered that, like gym membership. Like if somebody says, I have a gym membership, my Medicare pays. Medicare never pays those kind of things. Remember, they make more money, insurance company from Medicare. So insurance companies are offering you glasses, offering you, gym membership, all these things, over-the-counter health essential. Another thing, please remember, if somebody tells you all this, YouTube, all these things, $1,000, they give money for grocery or something. If something is too good to be true, usually it is. And $1,000, no insurance company that dumb to pay $1,000 a month to join their plan because they are making $1,500 a month to $2,000. So be careful. Lots of things happening. It's just amazing. Beginning of year, we convert people back to their own doctors because they made the same mistake. Okay. And Medicare supplement, you have no copays basically, okay? Because gap fills the gap. But on Medicare Advantage, you have an out-of-pocket maximum, which it means the worst scenario in like our plans, you will not spend more than $2,900 from your pocket. That's your protection. So everything has but Medicare, if you have an original Medicare, you pay ongoing, everything you have to pay. So that's why only Medicare is not going to work. Nobody has only Medicare. They have something else. Okay. Any questions up to this point? This is the most important thing people have a problem, okay? Have you heard about donut hole or coverage gap? Is it any of your friends, they say, I'm in donut hole? Jeff, have you heard about donut hole before? You know.
I have, sorry.
Yeah. Medicare has 4 stages on prescription. They call annual deductible first, which it means like your car insurance. You pay like 310, 500 something. Every company varies. It's about 500 is Medicare annual deductible. You pay 100% of that before you reach the initial coverage stage. So plan doesn't pay anything, and that's your limit. You spend 100% of the money. So then we have initial coverage. Then you go pay like a 0 for tier 1, 0 tier 2, 47 for brand names, and goes up to 33% of the cost for various specialty medication. Every company is basically identical on that. And like a leukemia, cancer, or self-injected medications, or like $20,000 medication. So in that, you pay your copay, and the company pays the balance to the pharmacy. The total drug cost that the government approved for this year is $5,030. It's not just only your cost and the insurance company's cost. Every insurance company, they will send you a statement. Please look at that. They exactly tell you where you're at. They put how much they paid, how much you paid year to date. When you reach $5,030, you are in coverage gap or donut hole. In that hole, donut, nothing in middle, right? It's a gap there. So to cover in that coverage gap or donut hole, now insurance company, you don't have a copay anymore. Only you pay 25% of the drug cost. But insurance company still pays between 5 to 75% of cost until you reach 8,000. So between 5,030 and 8,000 is a gap. When you reach 8,000, you're at catastrophic coverage, then you pay nothing for the rest of that calendar year. And next year, things are changing, but I cannot tell you because I will lose my job and my license on top of it. So it's going to be a little bit better next year. Okay? That's how much I can tell. This is really important. Okay? Any questions here?
No.
I think the drugs has a different tiers. Jeff, you want to cover the
So sorry, Fariba, just, so that is with or without the Part D?
No, that's with Part D. For Part D, it can be Part D on the Medicare Advantage plans that includes Part D, or on a drug plan, individual drug plan.
Yeah.
Anything has drug involved, that's the guideline. It doesn't matter. Nationwide, every company is a federal guidelines.
So that donut hole, that gap is something that is going to be something that people need to pay if they have that
20
much in the way of prescription drug coverage, even regardless of which coverage they have.
It doesn't matter. It's based on usage of, like, I have an autoimmune disease. I think you know, Jeff. For me, I'm gonna hit the donut hole in 3 months because one of my antibiotics is $1,200 a month. That's for ulcerative colitis. Okay, 1,200. So how fast I'm gonna hit 5,000? That's one medication. I will reach the donut hole in 3 months with the other medication if I am Medicare eligible, which I hope I can live to be there without health problem, without dying. I have a health problem. But anyways, something that they need to fix it. The only people now, if they have a low income subsidy or medical recipients, they have no problem like that at all. And most of us, we don't fall there. We are going to experience expensive medication. And next year, they're making it a little bit better. I hope they take away. Just wait and see. Okay. And I'm going to go really fast. The formulary, we have 5 tiers. Every company has a 5 tiers, tier 1 and tier 2, like levotiraxine, like metoprolol. Those are tier 1, tier 2 is 0 cost in most of our plans. Tier 3 medications are brand name, like Ozempic, like Eliquis or something like that, will be $47 until you hit the gap. And tier 4 medication is non-preferred drugs, it's like $100. And tier 5 medication, I was telling you, specialty medication is 33% of the cost of the medication. Sometimes the doctors, they give you like brand name, like Lipitor. Remember, Lipitor was very expensive before, but now we have simvastatin, statin family, okay? But sometimes patients, they say, oh, it doesn't work on me. And they can start with the cheaper one and step therapy. If it doesn't work, the doctor can move you towards the higher, more brand name if they have a generic medication. Sometimes people, they take narcotic medications that has a quantity limit required. Some people, they abuse it and they did die based on usage of that. So that's why quantity limit involves. If a person is too much, they are taking that. They usually now doctors are your primary doctors, they are not writing any of these medication painkillers. They are sending you to the pain management. And if people are like using too much, they put pump. The pump are limited. They program it that they cannot get overdose. So believe it or not, people are doing that. Few doctors, they lost their license. Now they don't do anything. Some medications, we need prior authorization. Some medication, like one of my medication, they had to get exception. If a medication is not covered, doctor can ask exceptions, okay? And they can ask 24 to 72 hours, they can expedite the decision of the company, okay? Really fast, I need to tell you, if somebody takes too much medication and you're not qualified for low-income subsidy, they have sometimes pharmaceutical assistance program through their foundation. They can give medications at no cost. But again, they have some kind of you have to answer their health questions, okay? And Jeff, do you want to see the supplement you said, right? While you want to ask me questions, I can stop sharing.
I mean, I think just in respect of time, about 10 minutes left. I want to make sure to leave it open for any questions that people have on things while we've got your time. And then And then if you maybe pull up, if you have your contact information available, but anybody have any questions on your specific situation? Otherwise, I know I was also talking about like just, touching a little bit on some of the networks and, is available pretty much in any network that people are used to, and kind of how people go about making some of those kinds of decisions. But wait to ask that until if anybody else has any other questions first.
I don't have it on my thing because usually the companies, they use my information, so.
Okay,
please
I
share my-
will, I'll make sure that everybody who's on this has your contact info when I send out the follow-up email.
Okay, I'm ready for questions.
Lynette, Daniel, Jim, you guys with any other specific questions? Concerns or?
Well, so so I'm gonna retire within a year. And I'm thinking that I do want to sign up for at least something that, maybe I need to talk to her, make an appointment and talk to her personally, or but I don't know if I need to yeah, my time, it's within a year, it could be sooner. So I'm
Okay.
not sure if I should sign up now since I'm still in that period, or wait. Maybe that's, when she sees, when I talk to her personally, maybe she can give me a better answer. But should I wait or should I mean, I don't know. I'm kind of in the, middle ground right now, whether I should wait or should I sign up now since I am 65. So
Okay, and sir, may I have your name again? Sorry.
Daniel
Daniel.
Garcia.
Daniel, definitely I can help you to sign for Part A because that has no cost. At least you create your Social Security account, you have social Medicare number. It depends again, if you are willing to pay based on your income level, premium, yes. But I tell people, why you want to waste your money?
Yeah, I hear that.
Let us look at that. See, is it worth it to switch? We compare if it's better to switch. If it's you don't know exactly when you're going to retire, it's just in the air, maybe to next month, or you're not really sure of it, that you're going to go anytime, not 66, then maybe yes. But definitely apply for A. You don't have to apply for A because it's entitlement. But if you need my help, I can walk you through how to do it. Again, it depends. I tell people, if you have a good creditable coverage, don't, because you're wasting your money.
Okay.
We can talk on one-on-one basis if you like. I'm at your service. Okay.
All right.
I pulled up something here for those of you who have access to Right Capital, our financial planning tool. I just wanted to point out that there is a bit of a module in here under the retirement section where we typically go to kind of look at, whether somebody's on track for retirement, income needs, and all of that. That there is a Medicare section under there. And it does give a little bit more of some considerations, some of the things that, again, probably having a conversation with Fariba will be able to help to identify that even further. But talks a bit about location considerations, current health considerations, and risk in terms of out-of-pocket costs, and allows you to be able to look at some of the different choices based on looking at those. And some things around enrollment, whether you're going to be receiving retirement benefits by 65, and then some of the things that Fariba was talking about in terms of group coverage, and whether you're with an employer with 20 or more employees. So just wanted to point that out, something that we could certainly talk about a little bit more in the context of your specific financial plan as well. So
Okay.